Now, the Ministry of Health has revealed a need of providing healthcare providers charging reasonable fees to patients that visit private facilities in the Patients' Rights and Responsibility Bill 2019 to protect patients' rights. Now, the remarks have been made by the Principal Legal Officer under the Ministry of Health in a meeting with a social society fraternity, members of Parliament and the Health Ministry officials to pave way on the push for the passing of the Patients' Rights and Responsibility Bill into the law.
Recently, the High Court ordered Ministry of Health for the regulation of fees charged to COVID patients in Uganda because many providers have exploited the situation by charging exorbitant fees to patients. It's on this ground that the Principal Legal Officer in the Ministry of Health, Brian Luswata, has revealed the need for the inclusion of the provision of healthcare providers charging reasonable fees to patients when they visit health facilities in the Patients' Rights and Responsibilities Bill 2019 to protect patients' rights.
We have not seen it in the bill, and we think this might be the most appropriate pathway through which we could have a provision that says that the healthcare provider should charge reasonable fees, so that under this bill the minister is also given powers to make regulations to regulate the charging of fees.
Luswata says the bill will provide the window where members of parliament will accept this provision to be included before it's enacted into a law.
This bill, I see that it might give us a window under which we could actually appeal to parliament that we could have this provision under the Patient Rights Bill.
Honorable Paul Akamba, Busiki County Member of Parliament and the mover of the Patients' Rights and Responsibilities Bill 2019, reveals why the bill was not passed by the 10th Parliament.
By the time the bill was sent to the committee had quite a number of businesses to handle, including the insurance, the health insurance bill. And so the chair, in his wisdom, decided to prioritize government bills first, and then that's how we ended up having the 10th Parliament dissolved before the committee could report on this bill.
However, Luswata says the patients also have the right to access medical records, therefore a need to ensure much emphasis on medical records.
And we shall appeal to our health professional councils to ensure that in their continuous professional trainings to their scheme of cadre, they make sure that they emphasize the issue of medical records.
Elisha Borikire from the Allied Professional Council says the Patients' Rights and Responsibilities Bill will improve service delivery in Uganda.
That it's a patient's right to have access to the records, and if you don't record well, that means you've lost it all.
Robina Kaitiritimba, Executive Director of the Uganda National Health Consumers Organization, clarifies on some of the provisions in the bill, especially in regards to service providers.
In the bill, if you see what the bill is saying, and this is what health workers need to know, that when a midwife is working alone 24 hours, the responsibility is going to fall on government to make sure that if you have a midwife working 24 hours, you are not observing the rights of patients.
Currently, the bill is before the Health Committee of Parliament, who still need to analyze it and table it for reading on the floor of Parliament. This story was filed by Julius Muhumuza for Dream TV News.